What?
Hi, everybody. It's Paul Finkelstein. I am RealMedicareMan.com. And of course, to my left here is YourMedicareLady.com. And she is, say hi.
Hi, everybody.
How are you, Medicare Lady?
I'm doing good.
Excellent. We're going to talk about your book today, Your Medicare Lady. I love the
Perfect.
title of it. Finally, an easy, straight to the point, finally, an easy Medicare education for boomers and seniors. The conclusive, clear, complete guide. Oh, we both have a copy. Excellent. Make no mistake about it. The roadmap to Medicare is now here. Brought to you by yourmedicarelady.com. And let's dive into chapter 3. And the title is called Is Medicare Free? You know, you've seen all those commercials on TV. Does that drive anybody crazy? I mean, just listening to, say, a football player or a basketball player, Joe Namath or somebody saying it's free, get all these great things. But is Medicare really free? Let's dive into that. Maybe you shake your head, yes or no. If you think it's free, it's not free, is it?
A lot of people, as they're embarking on Medicare, actually think that it's going to be free and they get drastically surprised that it's not. What? I worked all these years, all these decades, and now I have to pay for it?
You know your book by heart, I think, so I'm not even going to read that paragraph. But by the way, the amount that you paid towards your Medicare during your working years is a whole 1.45%. I guess that's your FICA contributions into Medicare when you're on payroll or working for somebody, or maybe you work for yourself, etc. And your employer pays 1.45% as well on your behalf for a total of 2.9% into Medicare for your entire working career. And that could be what, 10 years or 35 years?
As long as you're working.
Right. So is Medicare free?
Oh, gosh, no.
It's not. You know, Oscar Wilde, it reminds me of an Oscar Wilde quote. Actually, your book reminded me of the Oscar Wilde quote. And I quote, when I was young, I thought that money was the most important thing in life. And now that I'm older, I know that it is the most important thing in life. Now, I love it when it gets right to the point because there's some more information that I put a little note here for us to talk about. Maybe you have some thoughts on it. But if you don't qualify for a premium Part A, you might be able to buy it. And you'll maybe give us some details of what exactly does that mean,
So, what that
Medicare
means,
lady?
yes, thank you. So, what that means is in order to qualify for Medicare, we have to have worked a minimum of 40 quarters, which is the same thing as 10 years, and paying into the system through those payroll deductions. And then your Medicare Part A has no monthly premium. But let's say you didn't work the full 40 quarters, you worked less than that, then you could still get Medicare Part A, but you'll have a monthly premium. And what is that range, Paul?
Actually, you'll pay either $278 or $505 for each month just for Part A, depending on how long you or your spouse worked and paid Medicare taxes. But also remember that you have to sign up for Part B to buy Part A. Is that correct?
Yes, that is correct. And remember, if one of a married couple has not worked the full 40 quarters, but the other spouse has, then the spouse that didn't work the full 40 quarters can qualify for Medicare Part A for free based on the other spouse's work earnings and work contributions.
Now, if our pace is a little bit too quick or we're trying to jam too much information, this is actually just one page of 16 chapters in this amazing book, all about Medicare in a nice big font for you to read as well. Even the title there, nice big font. But we do have available for you today, just for listening to this lesson. This is the fifth lesson of 1,000 lessons to replace all of the lessons that are already on YouTube and across the web. I have 5 already, and I'm glad that Sarah guest appearance with me as well on these 1,000 lesson journey. But I do have available to you down below. It says easybuttonformedicare.com. That's easybuttonformedicare.com. You can download the PDF right away today for being our guest to listen. Or if you missed that, you can go to Amazon and search for Sarah Finkelstein. Instead of putting in a book or a product, type in her name, Sarah Finkelstein, and you'll be able to get the book for, I think it's $15 or $18, somewhere in there. And you could get the paperback that you could scroll through and underline and take some notes, and it'll be really valuable for you as well. How about we talk about some frequently asked questions or most commonly asked questions that I think you'll enjoy that are in this book as well. I'll just give you a couple of snippets. So the first question that we got that from a caller or a webinar or in-person workshops, this is where these most commonly questions came from. What if I'm still working beyond 65? Do I have to go on Medicare? And I actually had this come up with one particular person, or actually the other probably combo question was that this person was still working, they were 70, then they were going on Medicare and they were getting a penalty. So I need to find more information about their situation and whether they really deserve to have a penalty or not. So that's one more person we do have to reach out to. But to answer that question about if you're still working past 65, do you need Medicare? And of course, the answer is that depends on the size of your employer. If your employer has less than 20 employees, typically it's yes, you don't need Medicare. But if the employer has more than 20 employees, then you can stay on your group health coverage. That's the first one. Anything you want to add to that? Any thoughts?
Yes, I do want to add to that because of the Inflation Reduction Act, a lot of changes are happening to Medicare in 2025, one of which has to do with the drug plans, which is called Medicare Part D, D for drugs. So what you are saying, Paul, is correct. Somebody could stay on their group health insurance, but now because of the changes, they have to make sure that their group health insurance is still considered creditable coverage in the eyes of Medicare. So that's very important. And maybe some of those group health insurance are not going to be considered creditable coverage in 2025 because of those changes. For those of you who don't know, one of the big changes is that drug copays, prescription drug copays are being capped at $2,000 for the year for Medicare beneficiaries starting in 2025. So for those of you who maybe are taking really expensive medications and maybe you're spending $5,000 or $6,000 combined over the year for your prescription copays, good news, now your copays are capped at $2,000.
Thank you for that morsel of information. I just have one more that you might have mentioned a little bit about this question. It just came in. I haven't worked the minimum of 10 years. Can I still qualify for Medicare? And the answer, you can qualify for Medicare through your spouse if your spouse has worked 10 years or more. So that's interesting. Do you have anything to add to that one, yourmedicarelady.com?
All good tidbits and morsels.
Excellent. Oh, I do have to give you guys, this is a great segment that I want to put in here before we end this particular podcast, if you will. We have some real people, real testimonial. Sarah has helped numerous people, hundreds of people, for their Medicare supplement or Medicare Advantage Plan or Part C. We talked about Advantage Plan in it, or Part C in a prior lesson, and there'll be more lessons. In 1,000 lessons, I'm sure we could dive into all the different. You'll be an expert on Medicare, but you don't want this all at once because you ever heard the phrase, how to eat an elephant, Sarah?
One bite at a time.
Excellent. That's exactly right. You know the answer to that one question. So now you guys know the answer to that question. But happy client testimonials. It's always great to hear what other people are saying in their real words. By real words, real people, real testimonial. Exactly what Joe and Marion Clemente had said. And I quote, thank you, thank you, thank you. I love that they put 3 thank yous all in print for your help with understanding and choosing the supplemental Medicare insurance. We've been very nervous about our retirement when it comes to feel secure about health coverage and getting our medications. But you made us feel safe, secure about our choices. Thank you again for your patience and your time, Joe and Marion Clemente. Thank you so much, Joe and Marion. And one more, Luz and Carlos Vasquez. I quote, Thank you so much, Luz and Carlos, for saying these kind thoughts for Sarah and how she walked you through the enrollment process. I would like just to take a moment and thank you for your services you provided my wife and I. You were helpful, responsible, or responsive in answering our questions about Medicare. It will be our pleasure to refer you. You are good at what you do and listening and caring, and they say thank you. Of course, I say listening too because sometimes Sarah's phone rings and it's not just during the week at a 9 to 5 time. It might be on a weekend or it might be after dinner in the evenings. You could always reach yourmedicarelady.com or realmedicareman.com now as well. Thank you so much, everybody, for joining us. I think that's the last thought, so we'll just wrap up and wish you guys well for your Medicare. If you still need help or before December 7th, if you're concerned about needing to make a switch with your Medicare Advantage plan, or if your Medicare Advantage plan has been terminated, you now have a resource, because over the internet or in person, I always say we never have to be desperate. Everybody can be one of three things: a client, a customer, a resource, or a friend. If it's all three, you hit Vegas, but let us be your resource. It's absolutely free, no additional charge, and we're happy to be friends as well. Friends start with just one little conversation.
Well said.
Take care, everybody.
Thank you.
Till next time, this wraps up our 5th lesson on Is Medicare Free, which is chapter 3 in this amazing book. We'll be talking about other chapters tomorrow. Ciao for now, everybody. Thank you, your Medicare lady.